Hello, welcome to our latest Queen Elizabeth Scholarship presentation from the McMaster Health Forum at McMaster University in Hamilton, Ontario, Canada. I'll provide you with a quick rundown of the McMaster Health Forum, the Queen Elizabeth Scholarship Program, and the Queen Elizabeth Scholarship Program here at the Forum. I will then turn it over to our scholar presenter who will talk about their experiences. The McMaster Health Forum aims to be the leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders to act as an agent of change by empowering stakeholders. The Canadian Queen Elizabeth II Diamond Jubilee Scholarships, or QES for short, is managed through a unique partnership of Universities Canada, the Rita Hall Foundation, Community Foundations of Canada, and Canadian universities. This program is made possible with financial support from the Government of Canada, provincial governments, and the private sector. The purpose of the program is to activate a dynamic community of young global leaders to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. The McMaster Health Forum had a previous Queen Elizabeth Scholarship Program. We were very proud to have been selected as one of 20 Canadian institutions to host a second round of scholars. The new program ran from 2018 to the end of 2021, but was extended to the end of 2023. The focus of the McMaster Health Forum's current Queen Elizabeth Scholarship Program is strengthening health and social systems. Our scholars have contributed to strengthening health and social systems and have become part of our large and growing network of health and social system leaders. During our original Queen Elizabeth Scholarship Program, we hosted 14 incoming scholars, and we sent 3 outgoing scholars to work with our partners. We also had an additional 44 outgoing interns who traveled abroad to work with partners of the McMaster Health Forum. For our current Queen Elizabeth Scholarship Program on strengthening health and social systems, we have hosted 7 incoming scholars, and we have sent abroad 24 outgoing interns who have worked with our partners around the world. Our scholar presenter today is Annisa, who's a graduate student in the Master of Public Health Program at McMaster University. Annissa's interests lie in equity-focused policy and program development. During her internship, Annisa aimed to gain insight on Indigenous-led research and evaluation methodologies as they may inform improved health equity considerations for minority Canadian populations. Annisa, over to you.
Hi everyone, my name is Annisa Siu and I am a recipient of the McMaster Health Forum's Scholarship in Strengthening Health and Social Systems. So today I'll be talking about my internship activities as well as the experiences that I had in Sydney, Australia. So through this scholarship, I was matched with an internship at the Sax Institute in the Aboriginal Health Research Program in Sydney, Australia, and the Sax Institute is a non-profit organization aiming to improve health and well-being by driving research use in policies, programs, and services. What is great about this program is that it works in partnership with urban, regional, and remote Aboriginal community-controlled health services, also known as ACCHSs, to enable Aboriginal-led research. So overall, these ACCHSs are initiated by, delivered by, and based in local Aboriginal communities. They deliver holistic and culturally appropriate health services ranging from primary care to cooking classes, and in partnership with the Sax Institute, they conduct research where the ACCHSs nominate research priorities and oversee research conduct. And I've just listed the 5 ACCHSs that we partner with on the slide. So the program conducts a variety of projects. However, my main project was changes, and the objective is to seek a detailed understanding of healthy aging, cancer, and current cancer care from the perspective of older Aboriginal people in New South Wales, Australia. Just diving into slightly more detail about changes, the study seeks to understand the attitudes and perceptions among older Aboriginal people towards healthy aging, cancer, and the cancer care system. As well, it wants to describe the experience of the cancer care system, which aids in exploring the determinants of culturally safe care. And having this understanding will then help to identify enablers and barriers to accessing cancer services and supports, so that finally opportunities can be identified to improve the experience of the cancer care system for older Aboriginal people and their families. My main learning objectives for this practicum was to learn more about the existing healthy aging and cancer care pathways for older Aboriginal and Torres Strait Islander people in New South Wales, and I hope to identify opportunities for optimizing culturally safe care. Second, I wanted to learn and apply culturally sensitive approaches to qualitative research. And third, I wanted to learn about and participate in community engagement processes that successfully form and maintain partnerships between the research program and also local services or broader organizations. So for example, ACCHSs or organizations like Cancer Australia. So moving on to project activities, I had the amazing opportunity of accompanying 2 First Nations senior researchers to their qualitative data collection processes. So they took me along to 3 sites: Tharwal Aboriginal Medical Service, Orange Aboriginal Medical Service, and Orange Health Service, where we interviewed integrated care teams, older Aboriginal people with a cancer diagnosis, and a hospital Aboriginal health liaison officer. So the approach that they applied is known as yarning, and it is culturally prescribed. It still uses a discussion guide, but it's different from traditional interviews in that it's a very conversational process and it involves the sharing of stories. So it creates the time and space to reflect and share a holistic story rather than just a very straightforward question and answer format. So Carmel and Janice tended to share their own experiences during these interviews as well. I assisted with note-taking and conversation prompting in some interviews, and all participants were given $50 grocery gift cards. As well, I assisted with literature searches to refamiliarize our team with what research has been conducted since the grant was initially received several years ago. So we updated our understanding of what the gaps in the literature currently are and how we might address those. I also assisted with coding and thematic analyses for the transcripts for staff specifically, whereas Carmel took care of the transcripts for patients. And this was done on NVivo as well as Microsoft Excel. So we worked together to do a hybrid of inductive and deductive thematic analysis. And from these activities, we were prioritizing 3 main papers to work on. So the first paper was maximizing participation in programs and services that promote healthy aging among Aboriginal people. And this paper is very much focused on prevention. As a note, programs refers to activities and gatherings designed to engage older Aboriginal people, while services refers to entities that deliver medical care and support to older Aboriginal people. So this might include ACCHSs or the hospital system. Then paper 2 is Healthy Aging Needs to Start Young, Perspectives from Older Aboriginal People on the Role of Culture in Resilience Building. So this paper was expected to be a short 1-page piece that was very topical because older Aboriginal people were expressing concerns towards Aboriginal youth. And so we decided to dedicate a paper to this theme within itself. Then paper 3 is the role of ACCHSs in supporting older Aboriginal people on the cancer prevention, diagnosis, and treatment pathway. And we identified this theme after some consultations with mainstream cancer care providers as well as the ACCHSs. We heard that many mainstream cancer patients feel a sense of abandonment once their wraparound cancer care is completed and they go into remission. However, this theme did not really come up into our interviews. It wasn't reflected there, and this might be due to the ACCHSs filling that gap because they are a continuous sort of primary care provider. So this paper would highlight the strength that ACCHSs hold along the cancer care pathway and potentially identify scalable improvements. So across all 3 papers, I assisted with drafting the background pieces, identifying literature to support discussion writing, and throughout all of these papers, I applied a strengths-based approach, which I will elaborate on later on. Next, I also participated in some community consultations and events that uphold partnerships with the ACCHSs. So during these consultations, my supervisors would present preliminary findings and potential deliverables to the chief executive officers of the Aboriginal Medical Services. And these CEOs also acted as elders in their communities, so they are very aware of what the needs and strengths of their communities are. And during these consultations, our team would make sure that our research was aligned with the local priorities and that they would find our deliverables useful, such as for using our evidence to support their applications for future funding. As well, I had the opportunity to attend a Tharwal NAIDOC Week event, which stands for the National Aboriginal and Islander Day Observance Committee. And it's a day that celebrates the history, culture, and achievements of Aboriginal and Torres Strait Islander people. So the Tharwal AMS hosted a free community event that involved carnival rides, famous rugby players, and importantly, a huge number of health and social service promotion tents. So they had free hearing screening vans, educational materials, and just a lot of local care providers making connections with the community. And then lastly, I attended a food security workshop held with Aboriginal Affairs Government Department, and it was a chance to disseminate evidence that the team did on food security and to strategize potential supports. And at that meeting, 3 ACCHSs were also present. Then my final deliverable was a 5-page findings brief, which is a knowledge mobilization material. And I created this by synthesizing 2 research articles by our team talking about healthy weight promotion among Aboriginal children. And the intention of this knowledge mobilization piece was to support meetings with the state government, so that way evidence could be synthesized to bring a problem to their agenda and to make recommendations about policy and program development. Usually the publication process can take up to a year, but we didn't want to miss critical windows for action, so creating a briefing note is a way to disseminate preliminary evidence. And in this brief, I highlighted key strategies to sustainably fund family-based healthy weight programs that must be coordinated and delivered by ACCHSs. And through this, I also learned to apply a strengths-based approach in scientific communication. So throughout all of these activities, what really made them stand out was the amazing mentorship and support system I had throughout them, both in my Aboriginal Health Research team and also through the other scholars who came to Sydney with me. So a huge thank you to the Aboriginal Health Research Program and to McMaster Health Forum for giving me a chance to work with these amazing people that are pictured here. So these are some photos exploring Sydney. The first photo is of my office space in the Sax Institute. You can see pictured there the Aboriginal flag, the Australian flag, and the Torres Strait Islander flag. In the middle, you can see the Orange Aboriginal Medical Service signage and logo. And the last photo is from the Aboriginal Health Service Hospital, where they kind of posted these photo series that was professionally done, showing local faces of local community members to create more of a culturally safe atmosphere. And here I'm just showing some amazing views that I got to see going to the Sydney Opera House, where there was a sign welcoming all the visitors to Gadigal land, which is the land of the Gadigal clan. And it describes that a welcome to country is the customary greeting that First Peoples extend to visitors, who in turn agree to respect the traditional laws and culture of country. And then the latter 2 pictures are a picture of the coastal walk I did, which is a huge hike along the coastline. And along the route, there are conservation panels that point out engravings by Aboriginal peoples of the era group prior to European settlement. So if you look closely on the ground there, you can see an engraving of a fish, which is really cool. And last few pictures, the first one is showing how Sax Institute really created a welcoming environment for us scholars. They hosted a lot of events for us to get to know other people in the office, and this is one of them. And the second picture is of the State Theatre, where I went to the Sydney Film Festival to watch a screening of the film Kindred by Gillian Moody and Adrian Wills, who are both First Nations directors. And that was a documentary about their own personal experiences in being part of the stolen generation, where they were essentially stolen by the hospital system and adopted into other families. So it was a really informative and moving documentary that I definitely wouldn't have watched if I hadn't been in Sydney at the time. And so with all of that said, that concludes my presentation. Thank you so much for listening, and thank you again immensely to the Aboriginal Health Research Team and also to the McMaster Health Forum for hosting me as a scholar. If anyone has any questions at all, please always feel free to reach out to me, and I'd be happy to talk more about my experiences.